Welcome to the video abstract of the ongoing trial MELODY. My name is Maggie Banis-Paluchowski. I work at the University Hospital Schleswig-Holstein in Lübeck, Germany, and it is my great pleasure to present to you this international intergroup study. MELODY stands for Methods for Localization of Different Types of Breast Lesions. And if you would ask me if we need more research on this topic, then the answer would be a very clear yes. Then most tumors that we treat nowadays are very small, either due to improved screening modalities or because we give more neoadjuvant chemotherapy that makes tumors shrink. So, if we're planning a breast conserving surgery, we need some form of imaging-guided localization. And here we have very different techniques to choose from, starting with a wire, a technique considered gold standard in many countries, but we can use also probe-guided detection systems, and here are just some examples of them, like the paramagnetic marker MAGSEED, or a magnetic marker Cirrus Intuition. Then we have the radar reflector SAVI Scout or radio frequency identification tag localizer. We can also use radioactivity-based methods like radioactive seeds or the technique called roll. We can also inject ink into the lesion, or we can take our ultrasound machine with us to the OR to perform intraoperative ultrasound. Of course, if we give neoadjuvant chemotherapy, usually we will mark the lesion before start of chemotherapy, and then we have hundreds of different clips and coils of different shapes and sizes. So on the one hand, we have very numerous options to choose from, which is nice, and on the other, there is surprisingly little comparative data. So the randomized studies have looked at wire guidance, radioactivity-based techniques, and intraoperative ultrasound. And there's also very little data to say anything about patient preference and also satisfaction of the surgeon and the radiologist. So we need definitely more data, and this is why two study groups, EU Breast and IBRANET, decided to start MELODY. MELODY is a prospective, non-randomized multi-cohort study that is also non-interventional, meaning that our study sites can perform any form of localization that they do in the clinical routine. We plan to enroll over 7,000 patients. Patients with invasive breast cancer or DCIS scheduled to receive breast conserving surgery with imaging-guided localization can join the study. And we have two co-primary endpoints. First, we want to know if it works. So, has the target lesion been removed as at first surgery? The second co-primary endpoint is the negative margin rate. As you can expect, we have numerous secondary outcomes like re-excision rate, secondary mastectomy rate, marker displacement, localization failure, MRI artifacts. And one aspect that is very interesting to us is to see different perspectives. So there will be patient-reported outcomes collected after the surgery, but there is also a short questionnaire for the surgeon and also for the radiologist to document their preferences. The steering board of MELODY is very international, with representatives from EU Breast and IBRANET, but also from further societies and study groups that support the study, like Oncoplastic Breast Consortium, Senaturk, AWO Gynae, and AGOB. We expect 20 to 25 countries to join, and right now, and I'm recording this video in May 2023, we already have 3 countries with open study sites: Germany, Poland, and Turkey, and more are to follow. If you are interested in this study or would like to join, please contact us at melody@eubreast.com, and you can also find more information at melody.eubreast.com. Thank you for your attention.